like roughly trace their patella. It doesn't have to be perfect because the cast will capture it. Find their patella, find their joint line, so just bend your knee slightly and come back up. You're going to trace straight line across where her joint line is, and then fibular head. So patella, joint line, fibular head. If it is something wonky and they have Ossur slatters, or they've had surgery and they've got a weird screw sticking out, if there's anything weird going on with their leg, you can always just put an X. If it was Ossur slatters, I would just put an X over the lump, just so they know to mill out the inside of the brace so it's not in the way. So patella, joint line, and fibular head. I'm going to get you to hold this piece of rubber up the back, just so I don't snip her leg. You can put, when they have it in the instruction manual of how to actually cast a leg, they do have, it does say if it's a medial hinge, put it on the lateral side. If it's a lateral hinge, put it on the medial side. It's just easiest just to go up the back. As long as you're never putting that plastic cutting strip and you're not cutting where the hinges could potentially go. I always just put it up the back though, just so if you're looking through the user manual, you're wondering why it's up the back or up the side, and I did it up the back. So when you get your materials from Ossur, they won't actually send this piece of rubber tubing. This may actually be frozen. Oh, that's okay. So they won't actually send this piece of tubing. This tubing you can either get from Kaya or you can get from a surgical store. What it's going to do is I'm going to put it at the back as well, and it's just going to add a little bit of a lump, so it adds sort of a little bit of a space for me to cut the brace off, and I'll show you what I mean when I do that. I'll get you to hold that up the back too. So she's got the plastic cut strip, she's got the tubing, and then with lukewarm water, I'm only going to use, you'll be fine with just one, but the colder the water you use, the slower it takes to set. So the first couple of braces that you do, I would suggest doing it with a colder water. The hotter water you use, it almost sets instantly. So I usually just use room temperature. And the second you open the fiberglass, do you want to stand on that? It's just water.
Okay.
It's super, super clean. As soon as you open the fiberglass, it starts to set. So you don't have as much time to play. So as soon as you put the fiberglass in the water, you're just going to sort of squish it around a couple times just to make sure water gets all the way through the roll. And then just like a tensor, but not pulling as tight as a tensor, you're going to start from the bottom, making sure that tube is right over top of the rubber, and you're just going to overlap by half, just like a tensor, the whole way up her leg. And then maybe just don't move. If they move, obviously, it just doesn't set as correctly as it could. And when I said don't pull it as tight as a tensor, if it is someone, I mean, Amy's got an athletic leg, so she'll be fine, but if it is a patient that has a very soft tissuey leg, it will, okay, you can let go. And then if you have more, you can either cut it off or just go back down the leg. It doesn't make a difference. The more you wrap it around the back, the harder it gets to cut. And just smooth it out. If you do pull it too tight, like what I was getting at, the soft tissue will sort of go over and it'll be sort of a lumpy looking cast. It's not ideal, so you're just sort of laying it on tight enough so it captures the leg, but not pulling it super snug.
And then again, she's just in a relaxed stance.
Yep, just a relaxed stance. So the water was fairly cold, so this will take a couple minutes to set. If it was hot, you'd almost